Hi, welcome to Unscrubbed. I'm Dr. Abhishek Mangeshika. I'm a gynecologist and an endometriosis surgeon. I lead a multidisciplinary team, which is a tertiary referral center for India, Asia, and the Middle East, specifically for endometriosis care. This podcast is going to go through a series of episodes where we're going to focus on endometriosis, deal with different patient experiences, so they can relay their stories of struggle. So hopefully the patients who are coming after them do not go through the same struggle on their journeys, and also to create more awareness about the disease. On today's episode, I'd like to welcome Ms. Apoorva Joshi, who is not only a phenomenal nutritionist, but today she's here in the role of an endometriosis warrior. They say that the women who share their experiences act as lighthouses for those following in the treacherous seas behind them. And I do commend you on your bravery in coming out and speaking out about such a debilitating disease and your experience with this. Thank you and welcome.
Thank you so much.
Would you like to introduce yourself for our viewers?
So, I am a nutritionist and a corporate wellness coach. Most of my work revolves around women's health and diabetes management. Along with that, I'm also a foodie and a runner. So, I am really into health and fitness. Those are my interests.
Coming to endometriosis, would you like to share with us your journey and how you got there? But before you get started, I want you to know that this is a completely safe space. So you can feel free to answer any questions and share whatever you are comfortable with sharing.
Sure. So, I got diagnosed with endometriosis about 8 years ago. It started with menstrual pain, which I thought was normal. And slowly the pain went on increasing. From just menstrual pain, it went on to become gastric symptoms like puking a lot, finding difficulty in passing motions. I was in debilitating pain, and slowly it became difficult to live life normally. And that's when I kept complaining to my gynacs that this doesn't seem normal. And till then, everything was looking fine on the scans, etc. also. But one ultrasonography of my pelvis showed cyst on my ovary. That's when the gynac thought that this is worth acting upon, and that's how I discovered that I have endometriosis.
Right. So usually with endometriosis, this is a very typical story of how it presents. So there are 3 types of endometriosis. One is the most common one, which most people will have heard about, which are the chocolate cysts of the ovaries or ovarian endometriomas. It gains its name from the degeneration of blood products within the cyst, where it becomes dark brown or chocolate brown in color. And often these never occur as a singularity. There's always deep endometriosis, which is deeper lesions accompanying this. And those are usually the ones that are much more symptomatic and create the problems. So the typical story is when a chocolate cyst is diagnosed, and if the diagnosis is not made completely to rule out the deep endometriosis, a chocolate cyst is treated surgically. The rest of the time, the deeper disease is invariably missed or left behind, which is why endometriosis has this moniker of a chronic recurring disease, and which is also why many patients are subjected to revolving door surgeries, because they are never treated completely in the first sitting itself. So on an average, it takes about 7 to 10 years for a patient to have a diagnosis, and the average patient will have seen about 5 to 10 gynecologists in their lifetime before getting to specialist care. So when you were diagnosed and you had a surgery, are you comfortable sharing about what procedure was done and how your recovery was during that period? And were you put on any medications afterwards as an act of cleaning up the disease?
So I underwent a laparoscopic procedure to remove the cyst, which turned out to be an endometrial cyst. And later after that, my pain went down quite a bit. The pelvic pain I had reduced. Mm-hmm. But because I was told that to control this disease and to control the symptoms, I'm going to have to be on oral contraceptive pills. So then onwards, I was put on oral contraceptive pills in different cycles, like different length of cycles, sometimes 6 months, sometimes 3 months. And I would be very comfortable while I was on those pills. But the moment I got off pills, my pain and a lot of symptoms would return. So I wasn't really told what was the status of my disease then, because after the cyst was removed, all of my sonography started coming out clear again.
Right. So that's exactly echoing what the patient experience would be after just the removal of the cyst. A lot of them are put on some kind of hormonal suppression, whether it's a combined birth control pill or only progesterone or the GnRH injections, which suppress the hormones at the level of the brain. How did this disease affect your personal or your professional life?
So initially it was just menstrual pain that was getting worse, and I think most women are used to dealing with usual stuff like cramps or some pain, discomfort, disturbed sleep, etc. So till then I could deal with it because I was always used to it, but slowly it started getting worse where I started developing gastric symptoms. Like I wouldn't stop puking on the days I had periods. I found it very hard to pass bowel motions. Because of all of this, I had lost my appetite. So I would only continue to eat fruit and yogurt. That's the only thing I ate on those days. And the pain was so debilitating that 2 or 3 days of every month I had to take a leave, which would mean about 24 leaves in a year were just used to deal with endometriosis. And that was quite huge. And going ahead, the pain started about a week before and lasted for about a week after the periods were over. So that would mean about 2 to 2.5 weeks of every month were just spent on dealing with endometriosis. And I obviously could not afford to take so many leaves. So on most days, I just had to cope up with whatever was happening. And that those days, I don't think work from home was really a thing. So I had to commute for about 1.5 hours one way to work and back. So on most days while getting back from work, I would just doze off. And I would have to be woken up, ke madam aapka stop aa gaya, because I was so tired of dealing with all of this. That was my personal and professional life. So if anybody asked me to, like, for any plan, I had to plan it on the other 2 weeks where I was not dealing with endometriosis. So if anybody made a trip plan, dinner plan, anything, I had to first mentally calculate that am I in that those 2 weeks when I'm going to feel normal, then I can say yes. Otherwise, I will have to say no. So all of it had taken a hit. My personal, professional life, social life, everything had taken a hit.
And how would you perceive after your surgery and after being on the medication and you still had such debilitating pain and symptoms? What was your mental condition on dealing with this? You've been told by your doctors that okay, there's no more disease, and you've taken medication that should be suppressing any growth of it. Did it affect you on that level at any point?
So while I was on those oral contraceptive pills, they did a very good job of controlling the pain and symptoms to a certain extent. But the gynecologist I was going to was also of the thought process that you have to let your natural body cycle also give a chance. Like you have to let your cycle come naturally without having to rely on any medicines. So they would give me pills for about say 6 months or 3 months and then put me off pills. Whenever I went off pills, everything started again. While I was on pills, I was very comfortable. So slowly, I could see the pattern. And even though I've always been a fit person, I'm into health and fitness. So I was doing everything I could. Like I was eating well, I was exercising, I was trying to sleep better. So at one point of time, I felt like, that guinea pig who keeps running on that wheel, that no matter how much you run, you are in the same place. You are not moving ahead. So I felt like that no matter what I do, I'm not going to be able to beat this disease.
And also, I know that I follow you on Twitter and I know you're very active about nutrition and health and you're a very active runner. Obviously, if you're in pain for 2 weeks every month, you're going to have some severe restrictions on your ability to exercise and activity. How much would it affect your physical activity and nutrition also, since you had a lot of gastric issues as well?
So I ended up losing a lot of weight because of all the restrictions on eating, appetite, everything. And people would ask me, how did you lose all this weight? Because people knew I was into health and fitness. And I couldn't give them an answer because I can't tell them that I'm just losing weight because I have a disease. That doesn't sound right. And eventually I changed the gynac. I went to a gynac who was of the opinion that we can't let your quality of life suffer. So this gynac put me on oral contraceptive pills forever. He said, unless you decide to conceive, I will not take you off the pills because this is preserving your ovaries. This is preserving your quality of life. So this is what we do. So I was finally very happy with this gynac because I could finally go back to exercising. I did not have to worry about this disease. My pain and symptoms were under control. So that's how I found my way of dealing with this in a better way. But I did not know that this is not helping me in the long run.
So, like you mentioned, a very typical scenario is that the treating physician will put the patient on a continuous birth control pill or a continuous progesterone to suppress menstruation and to basically suppress estrogen. So this is stemming from an old myth, what is taught in gynecology, that pregnancy is a cure for endometriosis or menopause is a cure for endometriosis. So most treatments are aimed at suppressing the endometrium and the estrogen hormones. But what people don't tend to understand is that when they're suppressing the hormones, the disease is not getting regressed. It is not a cure for the disease, it is a control of the symptoms. At some point, the disease will outgrow the symptoms to a point where it will actually become symptomatic in spite of being on hormonal suppression. And in that case, it can have very devastating effects, including silent kidney loss or an obstruction in the intestine, or also in certain cases where it can get onto the nerves and start affecting motor activity of the legs. So, can you describe any challenges that you faced in getting a complete diagnosis and directed towards proper care or treatment?
So I faced challenges, I would say, in 3 different phases on 3 different things. First was diagnosis, next was like ongoing support and treatment, and the third was like what kind of treatment was offered. So diagnosis, I had to keep complaining about my pain even though I was like incapacitated on days when I had these symptoms. I had to keep complaining for about 1.5 to 2 years before I got diagnosed with this. And I was sure that this can't be normal. Everybody kept saying that a little bit of pain is normal for women to undergo. We have also gone through this and stuff. But it had to take those many complaints and those many visits to the gynac to finally get diagnosed. So I think I lost like 2 years of quality life in just trying to get diagnosed. And after I got diagnosed, after I got the surgery done, I wasn't really made aware about this disease. Like when they took the cyst out, there was still some other growth which was left inside, bowel growth which was left inside. But because I was put on oral contraceptives, I was under the impression that I'm done with this disease. This disease does not exist in my body anymore. We are just taking precautions. So I wasn't, told enough about the disease. Then the ongoing support, like now the ultrasonography of pelvis is not going to show this particular disease. There is in Indian setting at least, people don't prefer doing the transvaginal sonography on unmarried women because of the whole taboo around virginity. So I was never told to do it. I wasn't told to do an MRI also. So for about 8 years, I just kept struggling without knowing how bad was this disease or how is it going to affect my life in the future, etc. And the treatment that they had given me, the treatment was oral contraceptive pills. Initially, it did not create much trouble, but slowly I started to see changes. Like I started gaining a lot of weight despite exercising, despite, eating well as a nutritionist, but I still did not see much moving on the scale. Then I also started getting migraine more frequently. Like these pills have a lot of side effects of their own. So that became a concern slowly. And I had to start complaining about the pills also that, I don't want to be on these pills. But the only option was either you stay on the pills or you should get pregnant, and that will solve all your issues. Now, if I don't want to get pregnant, then the only solution left is to be on the pills. So those are the challenges I faced. And because I did not know how bad was this disease, like a month before things got worse, I was in Ladakh running at Ladakh and feeling my fittest ever. And within a month, I started facing issues with my bowel motions again. And normally one would suspect that one should go to the gastroenterologist to get this dealt with. But somehow I had a hunch that this has to do something with endometriosis only. And that's why I ended up seeing you and then got a full diagnosis of how bad this really is. So it took me about 10 years to come to a point where I could see a scan and see the disease on scan and actually know how bad it is.
Right, thank you for that. And you raised a very important point that usually when, as a patient visiting an OBGYN, you will be referred to a sonologist or a radiologist, and those level of ultrasounds that are done are literally only to visualize the uterus and the ovaries. They don't tend to do the level of ultrasound required where they're going to look at the rectum, look for nodules in the rectum or along the pelvic side wall. And even radiologists, for that matter, who do MRIs are not specifically trained to identify endometriosis as much as other diseases. So I've seen a lot of even very good MRI centers which will give a report of a normal bowel or a rectal structure when there is a very obvious nodule visualized within it. So I think you've kind of elucidated very well what the pitfalls in achieving this diagnosis will be for anyone. And we live in Bombay, which is supposed to be the most one of the most advanced cities in the country for medical care. And so this is not necessarily an India-specific problem. It's a global problem. It occurs all across the world.
And I was going to the best. I am based out of Mumbai. I was going to the best gynacs. I went to, I would say, 3 of the best gynacs in the city who were doing the best they could. I wouldn't say that they were not acting in my interest. They were trying to keep me in the most conservative way, like as comfortable as possible. But I don't think it worked in my, in my interest in the long run.
Exactly. You said that. So there's nobody is ever going to try and harm their patient. It comes into, there is a very severe lack of training for this particular disease. Even most people will acknowledge that it is one of the most difficult diseases to diagnose and also to treat. Yet there is a very large inertia and reluctance among the medical community to refer patients to specialist centers because the consequences of not treating the disease accurately are not going to cause the patient a loss of life per se. It is going to definitely be a loss of quality of life. So, but I think as awareness is picking up around the globe, there is a lot of awareness and the need for specialized centers to deal with especially advanced disease. So I think, and I'm hopeful for the movement, and I hope that we, with doing podcasts like this and creating more awareness and conversation about this disease, are able to expedite that process. So apart from surgery, what other treatments did you try which have been most effective in managing your endometriosis?
So one of the things that I was trying was just changing my diet enough to see whether this helps. So staying off dairy, staying off gluten. And in this whole process, like I read up, because I'm a nutritionist, I read up the research. It doesn't really say that it is going to help you control the disease much, but in some cases, people see some benefit in terms of symptoms. In the whole process of dealing with this disease, I became lactose and gluten intolerant. So I had to, by default, eliminate everything that contains lactose and gluten. And it was about 4 or 5 months after I started eliminating everything was the worst phase in this disease. So I don't think doing any of this controls the disease, but maybe it controls the symptoms to a certain extent. I also tried exercising. So in those periods when I was not on oral contraceptive pills or I was on some different types of pills, I would try to exercise and see if that affects. It kept me fit, but it did not help me with the disease much. Overall, I was fit and my well-being was okay, but it did not help me with the disease. And the oral contraceptives, like I said, they have worked on controlling the pain and the symptoms, but they caused other side effects.
That's true. So what did you like to use as, coping mechanisms for dealing with the psychological and the mental aspects of having this disease? And did exercise help? Did nutrition? You already spoke about nutrition, but did any exercise help in particular? Did physiotherapy?
So I would say exercise. Now this disease, even though seems like a physical disease, it affects your mental health just as much as it affects your physical health. Like if you are in so much pain, your quality of life is so bad, there's no way it wouldn't affect your mental health. So exercise is a particular thing that helps me deal with the mental aspect of it better. That once you go in the morning, like I try to exercise in the morning and start my day with it. That gives me a boost right in the morning, which makes me feel a little better through the day. Second thing I would say that helped me deal with this is just taking life one day at a time. Like even when I was struggling the most, I couldn't see like what I couldn't plan for the future because I didn't know how bad this disease would get. So in those moments of pain, I just had to take life one day at a time. Even after I got the recent surgery done by you, after that I was really scared about the recurrence of this disease, because having gone through such a brutal surgery, one does not want to go through this again. So I was just very scared that what if I have to go through this all over again. And that's when again I told myself that I have to just take one step at a time, one day at a time, and just focus on the next step. So at that point the next step was just rest and recovery, which I did, and I think that really helped.
Yeah, I think that's very important that you brought that up, because we need to learn to manage expectations from surgery itself, because these are big surgeries. They are, very complicated. Surgery is an act, recovery is a process, and recovery is never a linear curve. It has its ups and downs. There are good days, there are bad days, and recovery from surgery takes time, and you have to give it its due diligence and rest and recover well and work with the teams to get your functionality and mobility back. So I think that's very important. Do you want to share what kind of surgery you had? Because yours was a very unique kind of presentation in terms of the nodule, and then I'll try and kind of correlate what was done with how your symptoms would present in those cases.
So I had a growth pretty much everywhere into my pelvis. Like it was around the uterus, it was around the ovary, it was around the ureter, and the majority portion was infiltrating into my colon. So that's why the first symptoms that I started feeling was an increased urgency of urination, and the second one was finding it really hard to pass motions, because if this is like the pipe which through which the poop is going to pass through, it was really blocked, and it made me take a lot of effort to pass motions, and that wasn't normal. And the surgery that I had to undergo was a laparoscopic one, where most of this all of this growth was taken out, and it also had to undergo bowel resection, which means the colon had to the part where it was infiltrating the colon had to be cut, and the other two ends had to be joined back. So when I heard all of this initially, it was a big shock. Like I felt like I'm so young and I have to undergo such a major procedure. I'm a runner. I want to travel. Will I be able to do all of this post this surgery? Like what if I never get back to the normal place where I can pass motion properly, I can urinate normally? And that was a very big thing in my head that I was bogged down by. But on another note, if I don't get the surgery done, my life would anyway be worse than what it was. So that helped me make the decision that in case this is the thing, then I don't want it to get any worse. And 3 months after the surgery, one of the major things was about, can I travel and can I get back to running and swimming and all that? So 3 months down, I have already gone on 2 trips. I just finished running 7 kilometers this morning. I have gone back to swimming, so I'm back to like normal quality of life. So now when I look back, like taking life one day at a time was really helpful.
Wow, that's incredible. It's quite a journey. So I wanted to talk about the disease. So correlating how the symptoms or what symptoms you present with to what you will find at the time of imaging or surgery is, so bowel disease, which is basically in the intestine, is growing in the muscle layer of the rectum. So that is causing a constriction to where the stools can pass through freely, which is also going to cause pain. Now, in the rectum was not just stuck to the midline, it was growing into the lateral wall of the pelvis, where a lot of the nerves that supply the leg, that they supply the bladder, the bowel, and vaginal functions run. So it's not just bowel nodules, it can also affect bladder habits. So very common presentations are patients have pain while passing urine, or they have to push down on the abdomen to empty their bladder completely, because that function to evacuate the bladder is kind of compromised. And when you have these cases, these are very severe cases. So even after the act of surgery itself can render a neuropathic bladder, which is basically the conductivity of those nerves slows down because of the effect of surgery, and the heat used during surgery can slow down the nerve conduction in that area. So I think it forms a very important part of counseling the patient before surgery, that these are the possible complications that may arise. And I think we had that discussion, and I'm sure you were very apprehensive that because you went to a gynecologist and this crazy fellow is telling you he wants to cut out a piece of the intestine and you might need to wear a catheter for a long time. But I think once that initial processing happens of the diagnosis, and we understand how the disease works and how deep it goes, and once you can effectively clear it, of course, usually these cases are usually far much more complicated because of previous surgeries done in the area, which can lead to a lot of scar tissue and fibrosis in themselves from the act of surgery. So that makes life a little more difficult. But I think it's very important to get the diagnosis complete and to be very realistic with our patients about what we can achieve, what one can expect in terms of recovery and quality of life. And touch wood, you've done very well, and I'm happy to hear that.
Thank you so much for all your help and guidance.
So considering what you've been through, this very difficult journey, and I thank you once again for sharing your experience, what advice would you like to give to anyone going down a similar path or experiencing something similar like this?
I so hope not many women have to go down this path, but considering the numbers, I'm sure there are many like me who are going through the same thing. The first advice would be that pain is not normal. That if you are undergoing any kind of pain and you are told that this is normal, please don't take that as advice. If you think something is wrong, please get diagnosed. The earlier you get the diagnosis, the better it is for you, so that you don't have to go through the same things I did. You don't have to undergo such a brutal surgery. It gets detected early, treated early. Second thing is, if you come to know that you have endometriosis, once you've gotten the diagnosis, like if something were wrong with your heart, you would go to a cardiologist. Something were wrong with your chest, you would go to a chest physician. So if you have endometriosis, you have to go to an endometriosis expert. Just your physician or just any gynecologist will not do. To get the best kind of care, you have to go to the right person. And third would be that let's not forget that this is a chronic disease. Even if you've gotten one surgery done, or even if you've gotten some treatment and you think it is over, you have to keep a regular check on this disease. So, lifelong checkups, making sure that you are following up is very important.
That's very true. I think those are very good take-home messages and good advice for anyone going through a similar experience. It's one of the things you mentioned earlier that I wanted to talk about, especially in our country, is even when we are in med school, we are not trained to ask for sexual activity. We're trained to ask whether someone is married or unmarried. Now, this can play a very big hindrance in enabling someone to get a proper diagnosis, because assuming someone is unmarried and just based on that, assuming they're not sexually active, would kind of prohibit them from having a transvaginal scan, and they would be subjected to a transabdominal scan, which the transvaginal scan or an ultrasound is much more diagnostic in terms of being able to pick up endometriosis disease, especially in the pelvis. So I think one thing is we have to start as doctors, we need to start asking those questions about sexual activity and get consent to do the vaginal scans. And as you rightly said, it's a very, very specialized profession. You wouldn't go to a general surgeon to treat a brain tumor. And for a disease that is much more difficult to surgically treat than gynecological cancers, it truly does deserve its own subspecialty. I want to thank you for doing this, and it was a very useful, I think, an informative episode, and you shared your experience, which I think, rather than me spitting out medical advice and in doctor jargon, it is very resonant when a patient or someone who has been through the problem themselves can put their own personal experience on this. And I really do believe that it'll make a huge difference to whoever is able to get access and listen to this. So thank you for doing this, and I had an amazing time.
Thank you so much.
Thank you everyone for watching and tuning in. You can find all our socials in the bio below, and catch you in the next episode. Thanks.